Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue Salt Therapy, Part 48, Silicea-4. Silicea for circulatory symptoms. While sitting still or after severe exertion, palpitations, chronic heart troubles. Silicea for back and extremities. Sore pain between two shoulders. Scoliosis. Scoliosis, actually, look at this figure. Scoliosis. Scoliosis means the spine of the person scarred. This is called scoliosis. There are various forms of scoliosis. Has been demonstrated somewhere else in the Silicea. Please note, there are 4-5 types of scoliosis. Ricket, pain in coccyx bone after horse riding or motorbike driving. Inflammation of spinal cord. Pott's disease. Pott's disease is this type. Disease is called Pott's disease. This is Pott's disease. This is degeneration of spine bone. So tubercular infective diseases. Psoas abscess. Psoas abscess actually are within the psoas muscles. This is an internal abscess. Internal abscess, that when the abscess ripens, the pus and other inflammatory fluids accumulates in the groins region, and it is very difficult to identify what is this swelling for. Actually, it is psoas abscess. Hip joint disease. Hip joint disease in Felon, inflammation of fingers. Whitlow, to bring cure with creation of pus and new nail. Sometimes in Felon or Whitlow, the nail is destroyed. Then this Silicea can regenerate new nail. Here, local application of 3x is very much useful. Silicea for back and extremities. Spina bifida. The spine in the spinal cord comes out of its usual structures. Knee swollen stiff due to chronic synovitis. Necrosis of bones from opening of fistula. Piece of bones comes out. Fistula opening, therefrom degenerated bones, necrosed bones coming out. This thing is completely cured by Silicea. It is very difficult to believe this can be used in simple medicine as Silicea. Yes, generally these are surgical diseases, but Silicea is homeopathic surgeon. The medicine itself is surgeon. Fetid sweat from feet and armpit, internal growth of nails of feet, white spots on nails, nails developed, nails broken. Ankles very much weak, from ankles to instep. Instep means the mid of our feet. Feet very sore. Nervous complication after injury to spine bone. Tonic spasms in hand during writing. Hand and arms feel heavy. Paralysis. After long travel, painful tonic spasms in toes and feet. All these symptoms are very, very common. You can get a lot of this type of patient while in chambers. Very much pain in shoulders and arms at night. Better feeling from wrapping in warm covering. These are very, very characteristic, not characteristic, but key symptoms of Silicea. Silicea always feels better from wrapping in warm covering. This is tonic spasm. Tonic spasm, I have summarized, yes, this is here, tonic spasm. What is tonic spasm? These are tonic spasm. The finger or the portion get carved, deformed, and it is tight, fixed, tonic spasms. Silicea for nervous symptom. Epilepsy at night, in new moon or full moon. Whole body sore as if bitten by wooden stuff. Muscular spasms at night from several reasons. Very hard to overcome. McFoss, Calimure, Calculaphos. Everything also I mean, all of these three medicines are used in this situation. Unrelenting neuralgia, which is not tamed by hot or cold application. Affected part seems cold. Touch of wet, watery substance intolerable. Body so weak that they like to lie down always. Tremors of limbs with paresis. Paresis means paralysis actually. Tabes dorsalis, neurosyphilis. Tabes dorsalis is actually the dorsal portion and the back portion of the spine and spinal cord is degenerated. It is a form of neurosyphilis. Too much sexual excitation with extreme weariness. Mind the symptom. Extreme weary, yet too much sexual excitation. Tabes dorsalis. This has been in detail something has given. A disease of third stage of syphilis. After 10 to 15 years, actually 15 to 20 years, attack of syphilis, this tabes dorsalis comes. Dorsal column of spinal cord starts degenerating. Neurons, fibers which carry sensory information to brain gradually destroyed. Subject feel electrifying pain in limbs. Walk with legs far apart. Their reflex action, capacity, coordination, sexual capacity, muscular power, vision gets weaker. Argyll-Robertson people becomes positive. Argyll-Robertson people, ARP. Actually, this is a symptoms of nervous system. These Argyll-Robertson people becomes positive. It will be discussed later on in details. Now, what is Argyll-Robertson people? This is a clinical test. Clinical test means a test which is performed when patient in his chamber by the doctor. This Argyll-Robertson people must be positive if the patient is suffering from neurosyphilis. Now, how the positivity is confirmed? Argyll-Robertson people will be positive if pupillary reflex is absent and accommodation reflex is present. That is, with the help of two reflex testing, you can confirm that the patient is suffering from neurosyphilis or tabes dorsalis. Now, how it is done? You place a lighted torch just in front of his eyes and ask him to look at the torch. You will see that these two people will be very much contracted, and if put off, it is again expanded, or rather that was contracted, it will be dilated. In that case, the test is okay. But in case of neurosyphilis, this will not be there. That is, pupillary reflex will be absent. There is no response. You lighted a torch here and you put up the torch, the pupils are same. It is not contracting, not dilating. That is, the pupillary reflex present. Then if it is not that, then it is absent. If it is okay, then this will be contracted when you place it light in front of. When you put off, it will expand it. That is, pupillary reflex is positivity. Negativity, it will not respond here. That is, pupillary reflex absent. Now, what is accommodation reflex? Accommodation reflex is that you place a finger in between two eyes and ask your patient to look at your finger. You will note that the pupils are contracted and they are angularly pointed at your finger. Now you just replace your finger and ask him to look at a distant object. You will see that these two particular pupil will be dilated, and they will be the way of their sight will be parallel to. Then it is okay. Accommodation reflex is present. If it is so, that is pupillary reflex absent, it is not contracting, responding light, and this is okay, then the person is suffering from Argyll-Robertson people. This is a symptom. Confirmatory test from this, and if it is positive, then the person is a sufferer of neurosyphilis. If you cannot understand in one reading, please read 1, 2, 3 times, because this is a very important test. If you in your chamber you got a patient, anytime you suffer, you just suspect that the patient might be suffering from neurosyphilis, you have to perform this test, because you can do it. Anybody can do it who has minimum knowledge of testing with patient. I mean, clinical test. This is called clinical test. When you just look at the finger for whether the patient is suffering from anemia or not, whether he is suffering from jaundice or not. These are all clinical tests. So it is also a clinical test. Okay, this is video is finished. Any problem, please write down in the comment section. I will certainly respond. Like this, Mr. M.S. Nathkarni, age 50, complexion of skin was rosy white, but on careful observation one can note behind his black goggles the deep greenish black color around eyes. He directly informed, Doctor, my sex capacity is almost zero now, and in last 3 months I lost about 10 kg of body weight and my appetite gradually decreasing. I took a lot of remedies, modern medicine, got temporary result, no lasting improvement. Someone told me that he could give some lasting benefit. From query it is collected that he had a lot of sex from very tender age and alcohol was his second choice. When he was 30 to 32, I mean 30 and 32, he was attacked with syphilis. It was treated as per modern medicine. He had become perfectly okay. Few years thereafter, he got a peculiar copper-colored skin eruptions on both of his palm, secondary syphilis symptoms, and also on the trunk scatteredly. Those were also treated and was cured. I requested him to go up to the door and come back. I noted that his gait, that is, the style of walking, was not steady, rather a bit unbalanced. I held a pen in front of his eyes and requested to look at the tip of the pen. Now I requested him to look at the distant white building. In both situations, I noted the accommodation reflex was normal. Then, with the help of my pencil torch, I tested his pupillary reflex. As I expected, the same was fully absent. That is, the patient is suffering from dermatitis or neurosyphilis. I informed him that he had been suffering from neurosyphilis. It would take time to complete the treatment and he must abstain from alcohol if he wanted to cure, and his old syphilis might come back during his treatment. If he agreed to all these conditions, only then I would treat him. Mr. Nathkarni nodded his head positively without an iota hesitation. Syphilis 200x, one dose once in the morning for just 2 days. He advised to report after 15 days. Just after 15 days, Mr. Nathkarni came to chamber and reported that he felt very much better and his strength of legs increased to a lot. But as to sex, position was same and his appetite getting better. I knew once syphilis starts working positively, its action must not be disturbed. I prescribed 4 doses of placebo to be taken once a week and to report after a month. The placebo treatment was still continuing for 8 months. Just note, the placebo treatment still continued for 8 months. That is, within this 8 months, no new medicine was given. That 200x was working. 2 doses of Silicea 200x still showing its magic. Meanwhile, Mr. Nathkarni put on 5 kg of weight and his sexual capacity has increased a little. Most importantly, he got back the soft chancre in 3 different places over finished last month. He was advised, that is, returning of old original syphilis. He was advised not to interfere with the ulcers except applying plain water during bath. His treatment was still continuing. I am sure he would be cured. He would be cured. There are symptoms showing that he is going back to original disease which was not properly treated. And homeopathy, constitutional homeopathy or Hahnemannian homeopathy knows how to cure syphilis from the very root. Thanks for the listening viewing. If you got any problem, please write in the comment section. I will certainly reply.